Right on cue. Thank you so much, Jen. All right. We are using Zoom today. The functions that are most relevant for all of you are the little microphone that we have up here in the top left, mute and unmute. Like Kiki has mentioned, while we're chatting, we might go and mute folks when there's background noise. If we mistakenly muted you and you actually were trying to ask a question, just let us know and we are happy to pause and chat with you all, whatever your question or comment might be. As I already mentioned, you are welcome to have your video on or off. For now, we're going to have slides up. And so if you have your video off, everyone won't be able to see you with the slides up anyways, but feel free to do whatever is most comfortable for you, even if the slides are down. And then you're also welcome to use chat. Kiki will be monitoring the chat throughout while I'm on the slides, but feel free to jump in and Kiki will pause me for us to answer questions and again, chat with each other. The plan for today is really for us to do an overview of the legislation that really has been the kind of catalyst for this work. And those of you that are like, I've been at your trainings before and I've heard about these things, it might be a little repetitive. Consistency so that folks who might be new are caught up on that information. We're also going to talk a little bit about why a DC 0 to 5 crosswalk exists, what the purpose is, and talk a little bit about the work group that's going to get started, and also just share some additional resources if folks want to get engaged and involved. One of the things that is not on this slide, but that Kiki and I, we were like, this should be the first objective, but it's really one of the things we're most excited about is getting a chance to connect with those of you that are in the infant and early childhood mental health community, those who are new, those who are learning about it. And so even though the purpose of today is really around the DC 0 to 5 crosswalk, we're also just excited to have this chance to connect with those of you that are interested or already doing the work in the infant and early childhood mental health field. So Kiki and I will introduce ourselves real quick before we jump into getting to know all of you a little bit. For those of you that I have not had the chance to connect with yet, I am Christine Cole, and I am the Infant and Early Childhood Mental Health Program Manager at the Healthcare Authority. That's a really long title to say I focus on 0 to 5-year-olds and those who care for them. My background before the HCA was doing a lot of direct practice as a licensed clinical social worker. I've done outpatient and home-based services and consultation and childcare. And so I just love the infant and early childhood mental health field and I'm excited to get to do some policy work in this area instead. And I will hand it to Kiki.
Hey everybody, I am Kiki Fabian. I work with Christine at the Healthcare Authority. My title is Infant Early Childhood Mental Health Analyst. Before coming to the Healthcare Authority, I worked mostly in program evaluation, training and technical assistance for early childhood programs. And like Christine, I'm very excited to be in this new policy role where we have a lot of great work for infant early childhood mental health rolling out. And like Christine said, I will be monitoring the chat. So if you have any questions or concerns, please feel free to put it in the chat. And just to answer one question that we already had, will we get a copy of the PowerPoint? Yes, we will post a copy of the PowerPoint slides and a recording of the webinar to our webpage after the webinar is completed. And I will put the link to our webpage in the chat.
Awesome. Thanks, Kiki. And we would now, in the spirit of getting together with the community, would love to get to know who all is here with us today, and also what excites you about infant and early childhood mental health. Feel free to put those in the chat and Kiki will start kind of reading some things off. And I will just say, for those of you that are here and are like, I came to this not knowing what infant and early childhood mental health is, that is also okay. You do not have to already be involved in this work or know what it is to be here. We welcome you regardless. If that's the case, feel free to just share what you're excited about coming to do this with us today for. All right, let's see. Who do we have, Kiki?
I think everyone is thinking about
what to say.
Okay, well, Alicia jumped in. She was the first to comment. So we have Alicia Martinez from Best Starts for Kids in King County. What she's excited about is to be in community learning together, which is beautiful and exactly what Christine and I are excited about as well.
Thanks, Alicia. Thanks for being brave.
We have folks from Quality Behavioral Health that are excited to begin delving more into this population, wanting to connect to early learning programs, early intervention and prevention. Um, Libby from Molina says that she's been involved in infant mental health since the late 90s, before it was even called infant mental health. So she's very excited.
Awesome.
Early intervention, possibilities for the field, and love working with children.
Love
That's
it.
from Margie Somerville. Thank you, Margie.
Very cool. I love all the interesting cross-disciplinary work. Kiki and I are very excited about the opportunities for us to connect across different roles and opportunities. So excited for our mixed group today.
We've got some folks who've been advocating for years who are really excited to be here, folks who are wanting to learn more about how their agency can provide services, and a beautiful comment from Diana from Kindering about how there's so much amazing brain development happening at this age.
Very cool. You're so right. Anyone else who wants to introduce yourself before we keep going today? Again, if you haven't shared yet, if we move on, please feel free to drop things in the chat. We are really excited to have lots of folks here. But Kiki, anyone else we want to touch on before we keep going?
I think that's, well, we've got some more comments coming in, but just in the interest of time, we can probably move forward. And thank you everyone who shared. And we do also, because we are, a community, please feel free to read from other people's responses. And if you see something that's interesting to you, reach out to the person who shared that.
Thanks, Kiki. Thank you everyone for introducing yourself and letting us know who is with us today. I know that we don't get a chance to read every single one or have everyone come off mute, but Kiki and I definitely appreciate it and like the opportunity to kind of get to know folks. We are going to jump in a little bit on some background. This is the part that might feel like you're like, I've heard this a million times from you all before, just to make sure that everyone is oriented and familiar to what we're talking about. I also encourage you, this group is a group of folks who know a lot. Like Libby said, she's been doing this work since the 90s. And so encourage you, if you have additions to what I have to share here on this slide about what is infant and early childhood mental health, please add your own definitions or the things that you think of when you're trying to define this for others. Kiki and I, by all means, know that we do not know everything and that there is a lot of wisdom in the community. So I encourage and even would appreciate everyone adding if you have additions to what we touch on this slide. Kiki and I have been using this slide to really orient folks because as some of you probably are familiar, not everyone knows what infant and early childhood mental health is. And really when we're talking about it, it's a synonym for social emotional development. And we're thinking about children specifically birth to 5 for the work that Kiki and I are doing. And what we're talking about is really during these stages of infancy, toddlerhood, the preschool years, looking at these different domains that are listed on the screen here. So we're looking at how are kiddos developing emotionally? How do they make sense of emotions? Are they able to regulate their emotions when their emotions are feeling kind of big or overwhelming? How do they express their emotions? We're thinking about relationships. So the ability to form close relationships with caregivers, and that might be, my family caregivers, that also might be my preschool teacher or others in my community, and how am I able to build social skills with peers? And so really developing these relationships. How do I make sense of being in relationship with others? And then this last one here in the purple around learning. And so in infant and early childhood mental health, we think a lot about if we have secure relationships where folks help me to make sense of my emotions, to help me navigate being in relationship with others, I'm going to feel safe and I'm going to be able to explore the world and develop new skills and abilities and learn new things. And so we're thinking about those pieces all within the context of relationships. So we think about the fact that kiddos don't exist on their own or in some like little island by themselves, but that they have family and community and culture around them that really shapes how they develop in these different areas. Any good insights from the chat that we want to elevate before I keep going?
I think we're good to go.
Great. So when we're thinking about infant and early childhood mental health, Kiki and I bring this up because when we're thinking about this area of work, when we're talking about the service delivery, sometimes folks talk about developmentally appropriate mental health assessment. So There are certainly other services than just mental health treatment when we're talking about the infant and early childhood mental health space. But for today, that's what we're really talking about. And work both in Washington and nationally around what would developmentally appropriate assessment and diagnosis for this age group be has been going on for quite a while. So a national group called 0 to 3, they brought together folks to have this conversation, but others have been talking about like, how do we make sure our policies and practices all match what would it really look like to be assessing children in a way that looks at what is going on for the 0 to 5 age group. The reason for this is that the tools we already have, like the DSM, were really created for adults, and we've just kind of made edits and revisions to try and make it fit for younger children, instead of like, what would it look like if we had something developed specifically for this age group, looking at the developmental milestones and the relational needs of kiddos this age. So with that, 0 to 3, who I mentioned, pulled together researchers and clinicians and others and said, let's come together and develop a tool that is specific for this age group. And the current version of this tool is called the DC 0 to 5, or the Diagnostic Classification of Mental Health and Developmental Disorders of Infancy and Early Childhood, which is really long, which is why we call it the DC-05. For those of you who might be less familiar, this tool is really looking at these different axes that we have listed here and looking again at them through the lens of what is this child and family's culture and community. And when we look through these different axes, it's really trying to understand the family's perspective and what's going on for this child across domains before we arrive at a mental health diagnosis. And so for the purpose of today, I'm not going to go into each and every one of these different pieces, but looking at these, it's really saying like, how is this kiddo doing across these different areas of their life before we arrive at looking at a cluster or a grouping of symptoms. When we do get to that point, this tool, the categories and criteria, sometimes they have diagnoses that are similar to our adult systems, like depression, but the symptoms are altered a little bit to fit for what would this look like for a 3-year-old versus a 30-year-old. It also includes some diagnoses that don't exist in the DSM and other tools because they're specific diagnoses that present in infancy and early childhood, like what we have listed here, overactivity of toddler, disorder of toddlerhood. Kiki, anything you want to touch on for this before we keep going?
No, I think that's it. I will just say that I'll put, if you are interested in learning more about the DC 0 to 5, I'll put a link in the chat to some resources about it.
Thanks, Kiki. With that, there's some benefits to using the DC-05. When we have developmentally appropriate assessment, if we can really look at what's going on in the life of this child, their family, understanding it from a lens of how they make sense of this in this culture or community, that can help us to create better treatment plans and then provide better treatment because we have a good sense of what's going on and what the needs are for this kiddo and family. Additionally, the DC 0 to 5, it offers a way for us to have communication across families and different provider types. We had folks from early intervention here. We think about like mental health providers. We think about early educators, pediatricians, that a tool that is for this age group and that we all understand and learn about, we can then have shared language to understand what's going on for the kiddos and the families that we're working with. With all that in mind, there was a lot of years of work, maybe some people on this call who said they've been advocating for infant and early childhood mental health for a while, that last year in April of 2021, the governor signed into law what we were calling House Bill 1325, and it has some policy changes specifically for Apple Health, which is Medicaid here in Washington. So it included changes to our assessment process to allow up to 5 sessions so that folks had time to really look at all those different domains and all those different pieces that are going on for children and families. It included assessments in home and community settings, including reimbursement for provider travel, so that clinicians can go out and see what's going on for this kiddo in their natural environment, and hopefully, as typical of how they present in the world, rather than going to an unknown setting. And then this last part around requiring providers to use the current version of the DC-05. We are going to focus mostly on the requirement to use the DC-05 today. But when I switch to the next slide, we have a little note of where to go if you want to learn more about the billing pieces around these first 2 parts. So Kiki and I along with the partnership from many of our folks that are working at the HCA with us, have been working really hard on updating our policies, our billing guidance, our contracts. We've had a lot of partnership with our managed care organizations. And if you have questions about, wait, what happened with this? What am I supposed to do? We did do a billing webinar, and there's also billing resources that you can access on our website. I believe Kiki has shared that in the chat, and we also have the website at the end of our slide deck. We also have been doing a lot of work around creating a process for reimbursing for travel. You also can find more information about that on our website. And that has been a big topic. And so just want to note that both of those have a lot of information, and we will not be diving deeply into those today. But please feel free to reach out to Kiki and I if you look at the resources and feel like you're not sure what's going on. The last two, the green and the orange here, are specific to the DC 0 to 5 requirement. The green is highlighting that we received funds to offer training in the DC 05. We have a clinical training as well as an overview training, and I have some slides at the end just talking more about those opportunities in the future. And then what you're all here for today is that one of the pieces was around us developing a Washington specific diagnostic crosswalk, going from the DC 0 to 5 to ICD classifications and DSM diagnoses. Kiki, is there anything you want to touch on for this?
I think you're good.
Awesome. I'll keep going. So we wanted to share a little bit with all of you around why we have the DC 0 to 5 crosswalk included in this body of work, and what is a DC 0 to 5 crosswalk. So first, to start off, we want to just acknowledge that the DC 0 to 5, it's a clinical manual. You can get a virtual copy online, you can order a physical copy, and they do reference the crosswalk inside their manual. 0 to 3 has already embedded that in of like, if you're diagnosing a kiddo with this is the DSM that might be matching for it. Now, the reason that 0 to 3 offers this, and the reason that states and other folks are interested in a DC 0 to 5 crosswalk, is that the DC 0 to 5 provides a diagnosis, or this is the clinical disorder that I have arrived at using this 3 to 5 sessions. I've gathered a lot of information. I think this is what fits for the DC 05. Well, when we go to submit our claims to Medicaid or CMS, the federal Medicaid, they require that we include an ICD code. And so folks might be saying, well, I have this DC 0 to 5 diagnosis, but I have to give you this different code. And so that's one piece. The other piece is a lot of times electronic health records have already crosswalked the DSM to the ICD code. And so folks might be saying, well, but what am I supposed to input? Because I have this DC 05 and I don't have the DSM. And so for that reason, 0 to 3 and other places have created a tool that just has a table of matrices of saying, if this is the DC 05 that diagnosis you arrived at, this would be the DSM and the ICD that would be appropriate to enter into these systems. And so it's really a way to say, we know our systems are not set up to accept the DC 05, but if you're using this tool and you need to use these other classification systems, this is how you would know what to put in those. I'm going to pause to see if that's all making sense, or if Kiki has anything to add. Looking good?
I think we are looking good, but this can be a tricky thing for people to wrap their heads around, especially those who haven't spent as much time providing services to children this age. So we definitely welcome any questions that you have.
Thanks, Kiki. And so as I go into kind of the development process, I think it's important to note that even though there's some information about this already in the DC 0 to 5 manual, that a lot of states and different regions have created their own regional or state-specific crosswalk, because each Medicaid agency and each state might have different codes that are turned on. And so that just means that are billable, that if you submit a claim with that code, that you would be able to get reimbursement for it. And so for that reason, a lot of states have used their own to make sure that their crosswalk reflects what is billable and allowable in their state. And for that reason, we have our own crosswalk, which we have an interim crosswalk that we're going to tell you about next, and then we'll tell you more about the future revisions. So in order to create an interim crosswalk, Kiki and myself have gathered some examples around what are the crosswalks that are already developed. So looking at 0 to 3's crosswalk, looking at what other states have created, looking at even the King County crosswalk that was created, to go and say, like, what have people already said is an appropriate fit for this DC 0 to 5 diagnosis to the DSM and the ICD. Then we took a lot of time compiling all of those and putting them together to see what made the most sense, and also looking at what is billable in our state and where are there places where there might be codes that aren't specific enough. So sometimes we have to have additional decimals on the code that's entered to make it a billable service through Medicaid. So we went through and did all of that, and we've launched that crosswalk on our webpage so that folks have that available, holding in mind that the intention of this legislation was that we would have a community-informed crosswalk. And so even though we gathered a lot of great information and examples from other places, with this time frame to launch a crosswalk alongside all these other policy changes that we're making, there wasn't time to convene everyone and make sure that this was like a well-rounded community-informed crosswalk. And so this is the first iteration. And now we'll be utilizing this version that's available to you all now to then build off from it for a community-informed crosswalk. Kiki, is there anything else you'd want to add to this part? I know this is a lot of, Kiki carried a lot of the foundational work for this, so she might have more to say.
I will put in the chat a link to an organization or an initiative called PRISM, which is for the National Center for Children in Poverty. I think NYU, might not be getting that quite right, but they have also been great partners in kind of pulling together what states are doing across the country to build crosswalks. And like Christine said, each state is quite different, especially when it comes to Medicaid. And so it really does take some tweaking to make sure that the crosswalk that you use is really applicable in your state. That being said, that we definitely in our next iteration are looking forward to having feedback from folks on the ground, as opposed to just really from the state leaders that we've talked to in other states and our own internal processes.
Thanks, Kiki. So like I mentioned, we have launched an interim crosswalk. Again, this is really thinking about, like, we could wait until our community informed one, but we know that folks are going to be hearing about this and getting training. So we want them to have something to reference in the meantime. You'll see here snapshots from our actual crosswalk, which is really exciting for our Kiki and I. I hope you all are excited as well. If you go to our webpage, you'll have access to it. And we're going to spend the next couple of slides talking about a couple different pieces of it. And so there might be questions, and Kiki can interrupt me. I also am going to hopefully get to your questions before you even ask them around how do we use this, and like, what about our King County crosswalk and things like that. So in theory, when you use the crosswalk, you will go through your mental health assessment process. And so if you look over here under DC-05, you'll do your whole assessment. You will, you have up to 5 sessions. You can do them in the home and community, and you'll identify, I think this is the DC 0 to 5 clinical disorder that most appropriately captures what I am seeing from this child and what I'm hearing from this family and how I'm making sense of what's going on. You'll use that to then look in the crosswalk at the different diagnostic categories. So we have them separated out, just like the DC-05 manual. They have, neurodevelopmental disorders, they have anxiety disorders. We used those same categories to kind of separate out the sections of the crosswalk. That'll help you figure out what page do I go to. And then you'll see a list on the left-hand side of all these DC 0 to 5 disorders. So the example on this slide is social anxiety disorder or social phobia. When you go to the middle line, that will give you the DSM diagnosis. So in this case, social anxiety disorder. And then if you go to the far right, that would provide the ICD classification. So social phobia unspecified. We've also included the codes, just recognizing that for some folks, you might be able to just type in the title of it. And for other folks, you might need to actually enter the numbers. And so we try to provide the most information so that whatever your system is, that you have the tools that you need to be able to get that. But that's how you would go about using the tool. I think that this is kind of the most succinct way we can explain it. But if any of you have challenges or questions, we are more than happy to offer support and just making sense of how to use this tool. Anything else, Kiki, for this one?
Don't think so, and we don't have any questions in the chat yet, but I will let you know if we get any.
Awesome. Thanks, Kiki. For those of you that are here and are thinking, well, what about these other crosswalks that already exist, especially the King County crosswalk? We know that has been brought up a lot as we've been doing implementation. Folks have said, hey, we did a lot of work on this. We do have a place in the crosswalk. At the end, Kiki nicely put the page here for if you want to flip right to it, that talks about this is the DC 0 to 5 diagnostic disorder and how we crosswalked it for the Apple Health version. This is what 0 to 3 had, and this is what King County had. Again, the updates that we made were really to try and reflect. We built ours as closely as possible to 0 to 3, and then tried to just make changes where it wasn't specified enough or it wasn't billable. And so that might look different than King County's, because King County's wasn't exactly the same as 0 to 3. And so there might be some slight variation. We are really excited. We're going to get to later in the presentation that there are some of the folks who are hopefully participating in our work group who were a part of the King County crosswalk and can kind of share their knowledge and experience and insights from when they developed their crosswalk. At this time, we are not providing a requirement that like Medicaid Apple Health providers have to use the Interim Apple Health crosswalk versus the King County crosswalk. These are just tools and resources for providers. And so if that's what you feel most comfortable with, we are not telling you what to do. We're just offering another option for folks. Anything you would add, Kiki, for this one?
We did get a comment for you, Christine, that the slide you shared before about the table summary was a really great visual.
Oh, thanks.
And Christine and I talk about this a lot, about how different principles around infant early childhood mental health can apply to policy and practice work. And I think one of the things that we have been reminding ourselves that this is definitely like a developmental stage process, that we're in the very early stages, and there's going to be periods of growth and regression as we work through what it means to actually implement developmentally appropriate assessment across the whole state for Medicaid. So what we'll do is like Christine said, we'll try to be clear whenever it's possible, like this is a requirement or this is not a requirement. But just to have in the back of your head that this will happen in a stepwise fashion and things might change in the future. And our hope is that all those changes will be really informed by community voice and community advocacy. So just another shout out to the possibilities of the future and how we really hope that that will be shaped by partnership with you all.
Thanks, Kiki. Any questions before I keep going? Because I know that we have like one more slide about the interim crosswalk, but I want to just create space for if folks have questions about this, and then we'll transition into the work group. So crosswalk specific questions from anybody?
A bunch of crosswalk geniuses here, I
think. Great. All right, I'm going to keep going then. So I'm going to refer back to this slide in the future, but wanted to just give a specific shout out that if you look in the crosswalk as we have it now, there's going to be places that reference a DC 0 to 5 crosswalk feedback form. And this was a very intentional inclusion in our crosswalk. You know, Kiki and I were wrestling with, you know, this is supposed to be community informed, and like, how do we get the most feedback from like the largest representative sample, and knowing that if we pull together a work group, like you'll have to minimize it to some degree. And so one of the things that we really wanted to make sure was available for folks, regardless of what your role is and where you're doing your work, is that there is a way that on this tool you can go and say, actually, this ICD-10 code is not working for me. I get denials on it whenever I use it, or this doesn't make sense, or this doesn't fit with clinical practice. And so this is a tool. It's very simple. It'll auto-populate into a survey, an online survey tool that you provide your feedback. It's pretty open. Kiki could probably give more details about the fields, and that will come over to Kiki and I, that we can utilize this with our work group and ongoing beyond the work group to really be hearing from the community around this fits, this doesn't fit. And so keep an eye out in terms of when you're utilizing the crosswalk for this like little box here, and there's some other places that it's listed. If you have feedback about anything about the crosswalk, I'm assuming that we'll probably hear what things aren't working, which is great, but also feel welcome to share things that are working. We like to hear the things that are going well too. But this is a way that folks, regardless of if you had the time and capacity to participate in the work group or things like that, that you can share your input and have a voice in kind of how we're shaping out this crosswalk. Kiki, anything else folks should know about the feedback form?
Just as a heads up that it will have space to put your name, contact information, but that's not required for people to submit feedback.
Yeah, awesome. Thanks, Kiki. This also, like, there might be times that Kiki and I reach out and say, like, we need more information if you do give your information. So just know that as well, that we might have to touch base with you all, but excited to hear from folks around how it's working and if there's any challenges that you face. And now to talk a little bit about our crosswalk work group, just to give a heads up for folks that did share an expression of interest and we've reached out to you, I will probably be indicating that you can come on camera, come off mute soon. So please feel free to prepare yourself. And if you don't want to, you can obviously choose not to. That's totally fine. The purpose of the work group, like Kiki and I have already talked about a little bit, is really to make sure that the crosswalk that we're adopting as at the HCA is a crosswalk that is really informed by clinicians, stakeholders, and advocates. That, you know, when we have this tool, that it's not just based on this is what we pulled from 0 to 3, and then we as at the state just made these tweaks, but making sure that it's representative of the clinical perspective and the actual practice out in the field. And so that's really the purpose of us coming together, is that we can review our interim crosswalk and revise and update it to make sure it's reflective of a larger perspective than just Kiki's and mine. The work group process. The plan for the work group is that we will meet monthly starting next month and running through June. Hopefully everything will go on time and we will be able to be complete then. We of course will extend the work group if the work isn't done, but folks will meet for 90 minutes. And then there also might be some reviewing of materials outside of meetings. The intention and kind of how Kiki and I have envisioned it loosely, because we want it to be informed by the work group and for the work group to have voice and choice in how we kind of do things, is that we will utilize our current crosswalk as like kind of a foundation to like build off from and react to, like this does fit, this doesn't fit. That work group participants, Kiki and I might share materials with each other to help us to think about pieces of it, of what fits, what makes sense. Is this an appropriate, you know, crosswalk based on clinical perspectives? And that will come together and have work group discussions around what fits and what doesn't. I'm sure that there will be places where we might have to kind of think about clinical judgment. You know, there's different diagnoses that I think there's different perspectives on if they're appropriate to provide to a 0 to 5-year-old and things like that. And so that's why it's really great that we have a large group that we can pull together that has diverse experience to kind of think together and wrestle with those conversations. I know that there's folks who worked on the King County one that have said, like, we had to wrestle with some conceptual conversations about what fits. And so really the intention is that this space will be to think about those things together. Kiki, do you have any thoughts that you want to add on this part? Okay, cool. So with that, we, I just want to name not everyone has confirmed, but these are the folks that we have all extended an invitation to be a part of the work group. For those of you that might have missed earlier communications, the process for selecting work group participants was that we had an expression of interest that was shared widely through our communication channels, that folks could say, yes, I would like to be a participant, and this is kind of my rationale for why I'm interested and what I have to bring. And we had a great response to that. These are all the folks that we have extended the invitation. I will just acknowledge we included all of these folks. I don't think there was anyone who was excluded, just because there was such great rich experience and knowledge. And so we are super excited for this group. And so if you are here right now and would be interested in coming off mute, coming on camera, and you are listed here to introduce yourself. And maybe Kiki, say why you're excited about the work group. Does that sound good? Okay, so share why you're excited about being a part of the work group. We would love to have you jump in now. So I'm gonna stop talking and stop spotlighting so folks can chat.
And it may be that I have to unmute. No, it's like Shiloh was able to unmute herself. So
I figured since I'm already already on the camera, I would go ahead and go first, and my name's first. So I'm Shiloh Allen. I work at Child Haven. I'm in the WISE program in the infant early childhood mental health. And I think what I'm most excited about the work group is it's so easy to become in a silo in this group and just as a clinician, and that this will allow me to connect with other people in the community that are doing similar work and may not see the same population as me. And to learn more as I learn more about DC 0 to 5, how I use it and how other people are using it. And I feel like I wish I could use it exactly as I learned it in the training. I'm like, oh, we need this to be done exactly. But our program was so new that we're still building it up so that everyone that comes in gets all the training right away to be able to do it. So I'm also excited to help do that too. So on to someone else. Thank you. Nice to see you all.
and we probably can just go through the list so that people know when they're coming. So I see that Sally is here. Sally, would you like to go next?
Sure. So I'm Sally McDaniel. I'm a program manager at Greater Lakes Mental Health, and I'm in Child and Family Services. You know, we've had a lot of young children, and our clinicians get them, and they think, "What am I supposed to do with the 3 and 4-year-old?" So we wanted to build a more robust infant mental health program. I recently have taken on a contract with Tacoma School District, and I have clinicians in all the ECAP and Head Start. So this is also a good mesh with that, because we're filtering a lot of those kids back to the main building or to other places in the community. So I think this is just, we have some clinicians identified that work really well with young children. So this is the perfect time to kind of launch this program at Greater Lakes.
Awesome. Thank you, Sally. Next on our list, we have Marie.
Thank you. I'm Marie Soul. I have a private practice, Child's Place. Have about 20 years in working with infant and early children, and remember using the older crosswalks from many years ago. And I remember feeling kind of frustrated, like, oh, that doesn't quite fit. So I am super excited I'm sure it was really super difficult to do the crosswalk back in the day. But so I'm just really excited to be part of the process of looking through what matches, what doesn't match, and then just being a part of the community that is so interested in this evolving work. So yeah, thank you very much. And it's very exciting to be here today with you all.
Thanks, Marie. We're so glad to have you. Next, I'll pass it off to Kristen Price.
Hi, can you hear me? I hope.
Yes.
I'm also in private practice in the Vancouver area, and I've been working with really young children since the early 1970s. So I've seen many, many changes in practice. And my interest is sort of twofold, because I think that this type of diagnostic system needs to be used by private insurers as well as public agencies. So some of the feedback that I'll have has to do with working with working families and other families who have children with developmental issues.
Thank you, Kristen. Appreciate that perspective. I believe that Lou and Catherine are not here, but we can come back to them if they show up later. So for now, I will pass it to Jamie.
Hi, everybody. Jamie Elsie here. I'm a clinician and DC 0 to 5 trainer. Long been involved in advocacy around policy work for this, and so super excited to get to see it come to life here in 2022. I think I'm most excited about the work group because I can tell that Healthcare Authority is really interested in getting the lived experience of clinicians and agencies and making sure that we produce a product that is going to actually work in the real world. And so I'm excited to help be a part of that process.
Awesome. Thank you, Jamie. Heather, I also believe is not here, so I will pass it to Haruko.
Hi, everybody. My name is Haruko Watanabe, a program manager at NAVO's Infant and Early Child Program. I was just thinking back to when we were first trained in DC 0 to 3 back then, in use of that at the what is now Barna Center on Infant Mental Health at the University of Washington. And when NAVO's partnered with King County Medicaid system to develop its first crosswalk, this is 0 to 3 crosswalk, so that King County could serve Medicaid eligible families and provide infant mental health. It was such a new beginning, an exciting beginning for all of us. And there are some community partners here at the meeting today that also helped us with that as well. I believe Dr. Sherry Hill is in presence today. Thank you so much for continuing this work. I think this will help also hold providers accountable and encourage us to continue to do what is best practice, which has always been, 4 to 6. So we're moving toward, 4 to 6 assessment sessions, and we got 3 to 5. It's like, I think it's a huge win. So thank you so much, and it's wonderful to be in community around this topic. Thank you.
Thanks, Haruko. We really do appreciate you being here in community with us. So it's kind of funny, we've got a bunch of names that start with A, and I think all of those folks are actually not here. We have Abrielle, Avery, Arzu, Annie, Amy, and Amanda. So if they join on later, I will be sure to send a little flag up. But we also just wanted to comment that James Cheney, who works at the Department of Health around licensing for mental health professionals, will also be participating in the group as a consultant to us when we have questions about scope of practice, licensing concerns. And that's one of the areas where you may already know this, that HCA, DBHR, DOH are trying to work together to make sure that our work is in alignment, and that when we have different parts of the system that we're working together. So we are so excited to have James on board our team, and we look forward to introducing him to all of you if you have not already met.
Awesome. Thanks, Kiki. I'm going to pause before I move forward to just say, does anyone have any other deep burning questions about the work group and the work group participants? We really wanted time to highlight the folks that are able to come today. So thank you, folks who are able to make it, and introduce yourself. But for the larger group, any work group specific questions you'd like us to touch on before we keep going?
Alicia just shared in the comments that she is deeply grateful for the work group participants. Same, Alicia. I have to say that Christine and I were so thrilled when we, downloaded the responses from our survey and just saw so many people had filled it out and had expressed so much passion and commitment for this work. I think we felt a little overwhelmed and excited that this is all happening with such a great group of folks.
Yeah. I will just second what Kiki said. I was reading over the responses. Folks were very thoughtful and intentional in filling out all of the many questions Kiki and I asked. And I remember I messaged Kiki and was like, we have such a well-rounded, full of knowledge and wisdom and experience, as folks I'm sure heard when people were introducing themselves. Folks who have been a part of this community doing this work for a very long time. So we are super excited and honored to be partnering with all of you on this journey for the next few months together. And I'm sure we're going to get to know each other really well, which I'm excited about also. So just excited to hang out with all of you. Thanks, everybody. If you have thoughts, please just interrupt me. I'm going to keep us going, but we welcome questions later on as well. So Kiki and I also just wanted to highlight some opportunities for ongoing resources and engagement. If you've been in other trainings and other webinars, we highlight this stuff a lot. There's a lot of different work happening around this area, and so just want to make sure you know the different places that you can access what you need as we keep doing this implementation together. So we've mentioned a lot of times so far, we have a web page. We're going to keep directing you back to our web page. For those of you that have not yet gone to check it out, We will be continuing to update it over time. And so, you know, if you haven't heard from us for a while or you're wondering what's going on, this will be your landing page. This will be the place that you can keep coming back to that we will be updating as time goes on. We have a provider page, which is actually the second blue arrow that is more focused on the providers that are impacted by this policy change. So it has information about the travel reimbursement. It has information about our billing webinar that is very focused for if you are someone who needs to bill Medicaid, this is where you go to get the information about billing and reimbursement. The program webpage is a little bit broader in scope. This is really for anyone who's interested, who's an advocate, who's a stakeholder to hear about this like other implementation pieces that are going on. They link to each other. So if you end up on one and not the other, you can get to it. But just to kind of give you a frame of reference of why are there two pages? What would I access them for? The other tool that we're using for communication is Gov Delivery Alerts. Kiki has entered it here. You'll see if you're hearing about us from other groups, we often include this link so that you can sign up and get it directly. This is a way that as information comes out, we can send information to you saying like, hey, here's the billing webinar, how to register. So that's just another way to stay involved and to know what's going on. Kiki, anything you want to add to the communication stuff?
I somehow removed my spotlight, so I don't know if people can see me, but I think you can still hear me, right?
Yes.
Okay. The other thing I'll just add is that this is definitely a place where Christine and I are working to build out our communication system. We are, as real-time updates come out, using Gov Delivery, but because we know that not everyone has been familiar with that system or maybe has subscribed, we have been kind of passing along our alerts to other groups, organizations that have broad mailing lists, and that may be how you heard about this event today. So if you are interested in, connecting with us to make sure that your organization gets those Gov Delivery alerts, or you want to share them out through your newsletter, please feel free to let us know. We are always looking for new ways to communicate out more broadly to make sure everyone feels included and invited to the table.
Thanks, Kiki. I will note if there are ways that you as a provider or you and like your larger provider group are like, this is actually my preferred method of getting feedback, like please reach out to Kiki and I and share with us. We are both new to the HCA, fairly new to the HCA, and this is a new kind of like area of work that we're building out. And so we would love to hear from all of you on your preferences or even feedback on the web pages of like, this isn't clear. We don't know what you're saying here. So we are totally open to feedback. Please feel free to share it if you have any. Again, billing and encounter resources, just highlighting, you can certainly go to our webpage and find information. Kiki and I earlier this month did an introduction to billing webinar where we really went over the multiple assessment sessions and the travel reimbursement. That is recorded and available online if you'd like to watch that video and have more of listening to Kiki and I talk for an hour. You also can come to our office hours, which are next week. These were intended specifically for the purpose of like, you might have gone to the billing webinar and you didn't have questions then, but now like a couple weeks later, you're like, shoot, I wish I had asked this question. It might be that you missed the billing webinar. It might be that you asked a question and we said, we don't know, and we're going to try and have an answer for you by January 27th. So the office hours are really just a space for us to continue to hear questions and offer clarification where we can around this new like policy and practice around the billing and travel. You can always reference Siri and the Mental Health Billing Guide. These are tools that have been in existence for a long time at the HCA that offer reimbursement and encounter guidance. Those are updated either quarterly or semi-annually, and so those are also available on our webpage if you are wanting to dive deep into different CPT codes and when I can use them. And then the piece that I think we are most excited to just keep sharing with everyone, with this legislation, we did receive funds for free DC 0 to 5 training. We do not have the schedule ready yet, but it is coming soon. These trainings, there's two different trainings that are important to know about. One is a clinical training that's usually a couple of days training. So it's usually either 3 half days or 2 full days. where mental health providers can receive support around learning how to use the DC 0 to 5, the approach, how to go about doing the assessment. And so that is a longer one specifically for mental health providers that do assessment and diagnosis. There's also an overview training that is supportive for folks who might be referring to the mental health providers, or folks who do billing and might need to get kind of familiar, like, why are we using this? Administrators, advocates, all sorts of folks could fall into the category for the overview, just to kind of get oriented to what is the DC-05, why are we using it, and training to come soon. Kiki, anything you want to add for this piece?
I don't think so. Just feeling very excited.
We will have more posted soon. If you go to our webpage, if you follow the Gov delivery around trainings, we are super excited and looking forward to start offering those out to folks. So please join if you can, or pass it along if you hear about it. And
we
then,
did.
oh,
Sorry,
go ahead,
we
Kiki.
did get a really good question that I didn't quite hear everything you said, but from Kate Cross, are these trainings appropriate for business office staff in multi-specialty clinics with behavioral health integration? The answer is yes. One of the key audiences that we have for the overview training is business office staff, office managers, billing staff, anyone who deals with the kind of administrative pieces around Medicaid services, because we know that those folks are really important for making sure that our system of care functions the way it should. So we highly recommend the overview training for those folks, and thank you for that great question, Kate.
Awesome, thanks, Kiki. Any other training questions from folks? No? All right, I'll keep going, Kiki. You can interrupt me. We are actually coming to the end of our content. So if you have questions about anything really, or if you just have anything that you want to share, we will just have a couple more slides. It seems like we got through really quickly, which is always good when we end early rather than late. Kiki and I are super interested in connecting with folks. We have been providing our information. We are super interested in knowing what your questions are, what work is going on, but also just hearing about where things are at in terms of your practice, your approach to the infant and early childhood mental health. Kiki and I are just trying to get familiar with who's actually doing this work. And so please do not be a stranger. We're super open to connecting and getting to know you better. So always feel free to email. And then our last couple of slides are just resources for you all. These are Apple Health MACI, which is Mental Health Assessment for Young Children. That's what we're referencing for these policy implementation updates. These are just a lot of the different links for more information. I will specifically call out the Children and Youth Behavioral Health Workgroup. This is a group that is legislatively created. I always get that word wrong, Kiki. It's a group created by the legislature that focuses on recommendations to support the behavioral health system for children and youth in Washington. And they have several subgroups that have specific topic areas. And the reason I highlight them is they were a big part of this legislation. They provided recommendations for this legislation last year and have been a part of this coming into reality. And so if you're interested in advocacy or learning more about their work, this is where I would direct you to. It's the last bullet point here on the slide. We also have a bunch of infant and early childhood mental health materials for folks that are new to this area of work or just wanting to freshen up on some reading. Please feel free to check these out. And then DC 0 to 5 materials in case you're wanting to learn more about that. And that is all that I have for our slides today. Kiki, is there anything you'd want to add?
We did get 2 other questions in the chat about training.
Nice.
One is about whether we are promoting trainings to primary care, family physicians, and pediatricians. I'll give kind of a nuanced answer, which is that if at a primary care practice, you have mental health professionals who are doing mental health assessment, so social workers, psychologists, etc., they would be eligible for the clinical training. If you have family physicians, pediatricians who are doing a lot of work with families, those well child visits, behavioral health screening, trying to get kids connected to care, they would be eligible for those overview trainings. And we will be doing everything that we can to try to promote the trainings to all the different audiences we have in mind, including our primary care providers. So great question. And another question from Sally about, can you repeat when the free trainings will start? You didn't quite miss it. We haven't announced our schedule yet, but we are hoping to do that very soon. And just know that how the funding works is those trainings will continue currently through June 30th, 2023. So we have some time between now and then. And those are all the questions we have.
Awesome. Any other questions that folks were hoping would get answered by coming today that we maybe didn't touch on? So even if it might not have been in our slides, it was a burning question you had that we didn't include for whatever reason. Awesome. Well, like I shared, this is the end of our content for today. So I'm going to actually have Jen maybe end our recording, but Kiki and I can hang on for a little